Hey, Melissa.
Hey.
All right, here we are, another episode.
Yes.
We are on like episode 17 or something like that.
Wow. Okay.
Yeah, we're going good. We're going viral
Are we?
at a slow pace.
Yes.
Yeah, I keep getting these ads that are like, pay us and we'll make you go viral. I'm like,
I'm sure.
It's not that serious.
Mm-hmm.
Well, today, Melissa, this is a really cool episode because I feel like this affects so many people, and it's diabetes.
Yes.
Yeah, it's a problem.
It is very common, way more common than it was, 30 years ago.
Mm-hmm.
Big problem in our area, Mississippi. And yeah, we're going to talk about kind of what it is, where it came from, how we can prevent it, fix it.
Exactly.
All the things.
That's right. All the things. Exactly. I think that's the big focus is like, this is a bad thing because of what it does to people, but also what it does to the system, of healthcare. But the big thing is it's a dietary disease, so we can fix it. We can prevent it. And I think that's the point that maybe people kind of think about it can be preventable, but no, it really is preventable. But you have to be aggressive. You got to be early. So we're going to spend a lot of time on talking about that. But I'm excited.
Yeah.
Yeah. And I think one episode we have a friend who actually is a diabetic, kind of get her on the show, talk about her experience with diabetes. She's kicking butt right now. She's controlling the fire of that thing. And we're going to see like, how did it happen? What kind of motivation she had, and even her daily practical life. How was she able to do that?
Yeah, that'd be great.
Yeah. Well, let's start with the big arching picture. So obviously, our healthcare system in the United States, we spend a lot of money. In fact, we spend double than any other country in the world. And diabetes is a big part of that. In fact, this was back in 2018. They said every year we spend about $327 billion on diabetes.
It's hard to even imagine that amount of money.
Yeah. What would I do with $327 billion?
Yeah. Well, imagine what our country could do with that, and that's people's money that they're spending on, hospital bills and medical bills and medications. And what else could you do with that?
Yeah, exactly. I mean, they said, right, and a diabetic on average will spend about 2.3 times more money than a non-diabetic. And that is just their own money. Right. So these are monies that you would use on vacation or, refinance your house or, eat better food. All these things, that you could use for other things are now being taken away because the diabetes needs it.
Yeah.
Yeah. So, and that becomes a problem because the second part of it is, we talk about money, and money is a problem. That's a scarce resource. You need it, right? But more importantly, diabetes has now become the number one cause of blindness, the number one cause of amputations, the number one cause of chronic kidney disease that causes dialysis, which is mind-boggling that now this has become the number one problem.
Yeah, it's crazy. And I don't think, some people may not even realize what impact on quality of life that can cause. A lot of people may think, well, diabetes, if I ever get it, I'll just take some medicine and live my life, but really, when the disease progresses and, some of those conditions may arise, spending 4 hours 3 times a week at dialysis, like, what else can you do? You can't work. You can't, do, travel,
Right.
all kinds of things that is going to impact your quality of life long term. So a lot of people don't think that far into it. They think, well, I'll just treat it when it comes, but really, it can be one of those really life-limiting conditions.
Exactly. You think about dialysis, the time it takes, blindness. I mean, just playing tag with the kids in the dark is super frustrating because you can't see anything. You're trying to find them. You're stubbing your toes on things. Imagine that all day long over a disease that doesn't have to be.
Right.
Yeah,
something that's preventable.
Right. Exactly. It's not like a freak accident where a piece of iron fleck got flung in your eye. This is one of those this is something that goes on over time. And I think especially with some of these complications, they take decades to form, which means that we had decades to stop this from happening. We just have to be serious now so that won't happen in the future.
Right. And knowing where you're at. I think that's a big part of, what we do every year as we're seeing patients for their wellness visit. It's that one time a year where we screen for things like this. And if you're not getting your regular checkups and just happen to go in like once every decade, you don't know how far advanced you might be from, say, age 40 to age 50 if this goes undetected. The disease can progress, and the later you catch it, the harder it is to reverse or improve.
That's exactly right. Yeah, and we'll put that little tidbit here. What we do know is people who have diabetes less than 5 years, reversibility is really, really good. I mean, we can stop it, we can reverse it. Once people get above that 5-year period, it becomes harder. Doesn't mean it's impossible, but more than food, most people will most likely have to be on some type of medication for the rest of their life. So all that being said, we want to, I like that plug for the wellness, Melissa. Right. If you don't know where you are, obviously you don't know how to start. Right. Mm-hmm. And so the statistics say 1/3 of America has prediabetes. Mm-hmm. So that means if I grab 3 random strangers off the street, come in here, one of them will have diabetes.
And not even know it.
Mm-hmm. Which is a problem.
Yes.
So all that being said, Melissa, we are going to do our best to try to fix this thing. Mm-hmm. Right. All right. So let's spend some time really, I think, telling people how this happens. It's a lot of biochemistry. It's a lot of chemicals, but we'll try to simplify it because I think once people understand how it happens, they can actually fix this thing. Diabetes is actually a problem of insulin resistance. So people hear that term all the time. In fact, people hear like apple cider vinegar fixes insulin resistance. It probably doesn't do a whole lot of that. But the idea is insulin is a hormone in your body that is made to help store food. Right? So whenever you eat something, food gets absorbed, your body has to store it or burn it, insulin gets secreted, and it puts this food into the cell. And once it gets in the cell can use it. Everything's happy, life goes on. But in diabetes, what's happened is over time, we've had so much sugar in the bloodstream from all the food that we're eating that the body is making a lot of insulin to push inside the cell, but the sugar keeps leaking out. So the picture I like using is kind of like a suitcase, right? So the first few clothes you put in, no problem. Near the end, you're sitting on the suitcase, you're kicking it in, you're trying all sorts of things to kind of get it in there. But it keeps popping out. And so the idea now is maybe back in the day, 1 molecule of insulin can put away 1 molecule of sugar. Now you need 10 molecules of insulin to put away 1 molecule of sugar. And hence the definition of insulin resistance starts to happen.
Yeah. Yes. Yeah. That was a really great way to put it and kind of like put it into a relatable scenario. I think that was good.
So good. Well, thanks, Melissa. I like that because most of the time I get carried away in my biochemistry and nerdery.
No, that was good.
Yeah. Well, okay. So like I said, now we know that, okay, if we have too much insulin going on and sugar's just spilling out everywhere, then when we check your blood sugar, that's when we start noticing like, hey, your blood sugar is going up, right? Mm-hmm. But the big problem is how do we deal with that insulin resistance? And so most diabetes treatments and medications are all targeted on either A, getting rid of sugar, right? So if I can get rid of sugar or have less sugar in the system, whether we eat less, whether we pee out sugar, that will help lower insulin. Some of the treatments actually try to increase insulin, like literally giving shots of insulin. But the data for that has not been the greatest as far as stopping heart attacks and strokes. Uncontrolled insulin levels, so high insulin levels because of high sugar levels over time also increases cancer risk, colon cancer risk, breast cancer risk. These are what we call obesity-related cancer. So all that being said, there's a lot of things playing a role, but the big picture is get rid of sugar so insulin levels go down. Insulin level goes down, diabetes starts reversing.
Yeah.
Yeah.
So. Yeah. And that's a big part of it. Just like you said, it's a diet related disease. We didn't just all of a sudden start developing diabetes for no reason. It was over time, the things that we consumed, the more sedentary lifestyle, the increase in obesity, all these things lead to that path of insulin resistance and then diabetes.
Yeah. So, and I like what you said there, Melissa. This is a dietary disease. So that means the fix has to be dietary as well. Mm-hmm. we won't touch on medications in here. All that being said, there's a lot of medications. Stay on the medicines. That would be my only plug, because I have a lot of patients that maybe they feel like they're done with medications because the sugar was controlled, and they stop and the sugar goes crazy. We don't have time to touch base on medications here, but the take-home point is don't just stop.
Yeah, don't just stop. Although I will say, our friend that you mentioned, she couldn't get one of her medications, with the Ozempic shortage and everything like that. Couldn't get it for a while. And she said, I'm going to be my own Ozempic. And she really exercising more, really doing well with diet. And she was able to maintain her sugars even without that consistency with her medicine. Now, I don't recommend that, but, as long as you can stay with your, consistent with your prescribed medication, that's ideal. But medication is only one part of the picture. You can make a huge impact with your lifestyle as well.
Oh, yeah, exactly. And I like that. I like you pointed out, Melissa. If you can't get a medication, I understand it is what it is, but right.
Yeah, call your doctor, but
yes,
don't just stop it. But, of course we were monitoring her, but, in that case, that's just one scenario where it kind of illustrates that, exercise, diet changes can be as powerful as some medications in some cases.
Oh, yeah, absolutely. So let's start there, Melissa. Food, right? So the first point is, we have too much sugar in the bloodstream. That's the mechanism. And so obviously certain foods raise blood sugar a lot more than other foods. So while the American Diabetic Association doesn't have a quote-unquote diabetic diet anymore, because we start realizing that everybody is a little different. People eat differently and they prefer foods differently. There is this idea of, we have to, the simplest thing is we have to cut out sugar, or so much sugar in our diet.
Yeah, yeah. And that doesn't demonize all carbohydrates. I think a lot of people do take the cutting sugar, sometimes a step too far, and then they cut out good healthy carbohydrates like whole grains and fruit and things like that. Those definitely still have a place even for diabetics, as long as you're, following your blood sugars and, eating an overall healthy diet. But the sugars that we're talking about, those really refined sugars that you find in, sodas, cookies, candies, cakes, the bag of chips, things that are just really refined carbohydrates that, have no fiber, nothing to slow down that release of sugar. And we're getting big blood sugar spikes after eating those things.
Yeah, no, that's perfect, Melissa. I agree. Some people go completely no carb, and by that they take away all the healthy fruits and vegetables. It does more than just sugar for those foods, right? They have other nutrients and minerals that our body needs. And so you're exactly right. If we had to pick one, let's start with all the just processed stuff. Our body absorbs processed sugar like table sugar, sucrose, high fructose corn syrup very differently than they would absorb it from, an apple or something like that. So staying away from, and I guess this is common sense medicine, but say I had one patient, it's like, I ate 12 jelly beans, why did my sugar go up? And I was like, what are you talking about? Right, the candy, the honey buns, the pizza, all these things that I think our brain knows, the fried foods, the brain knows that this is probably not good for diabetes. Let's start eliminating things there. Because that, if we just did that is a big one. Liquid sugar, I think, is a really, really big one. A lot of people tell me they don't eat a lot of, sugar, but they do drink a lot of sweet tea, Coke, even Diet Coke and Coke Zero, while they technically don't have any sugar, they still increase that insulin response in the body. Alcohol, those are things that a lot of people maybe don't realize just keeps dumping sugar back in the bloodstream, which causes the insulin problem, which continues to make their diabetes worse.
Yes. Yeah. And yeah, that's perfect. If you can start anywhere, eliminating those, heavily refined sugars, the sugary beverages, anything that is really unrecognizable. I mean, you're not going to get like, sweet tea from like a river. Not like, you know what I mean? It's just like
not drinking some sweet tea from a creek.
And you don't have to go completely like granola, but I mean, eating things closest to their most natural form. Mm-hmm. The more it's processed, the less healthy it is for us in general, as a general rule.
Yeah. I have had a lot of patients. They say the rule of thumb is like, if it comes from the ground, you can have it. And that makes it easy. Right. You said that, I imagine like sweet tea just flowing like a river. And I'm sure like the rabbits are licking. They're like, what is happening here?
And then the rabbits would be diabetic.
That's right. That's so funny. That essentially, okay, so side note, when we have like rat studies and stuff like that, to make a rat a diabetic, I mean, you just feed them like processed grains and stuff like that, and they'll become diabetic,
mm-hmm. And that is like the proof that if you are unsure if this is a dietary related disease, you can produce diabetes in a rat or in a rabbit or, and they do it in the labs, know. So anyway, I mean, we'll occasionally find somebody that doesn't fit the picture of, the typical type 2 diabetic. Mm-hmm. Maybe they're not overweight. Maybe they actually do, follow a pretty healthy lifestyle and they develop diabetes. Those cases are rare. Uh-huh. I would say that is definitely the exception rather than the rule.
Yeah. Those are definitely near the like getting struck by lightning kind of thing. But the majority of the part, most people, if they're honest with their diet and they look at it, they see where it's coming from. Mm-hmm. Right. Now, obviously, if we're going to avoid all those highly processed grains and liquid sugar and stuff like that, the substitution would be more fruits and vegetables, right? Because the fruits and vegetables, specifically vegetables, they're low sugar content, they have high nutrients, and they're low calories, so calorie poor, nutrient dense. They have fiber, they have all these other minerals, they keep you full, they make you feel better. And I actually had a patient today, so she developed something called alpha-gal, which means she is now allergic to red meat. Mm-hmm. Which is like almost horrific because you're like, I'm in Mississippi, I can't be allergic to red meat. But she started increasing her plant intake because she can't eat that. And she feels like 100% better because once you eliminate a lot of the meat, which comes with a lot of the sauces and it comes with a lot of the different things that we add to it that are heavily processed and have a lot of sugar in it, and you go more like natural foods, the body knows what to do with that. Mm-hmm. You can almost see the blood sugar starts going down. Insulin resistance starts getting better. A lot of people's body composition starts changing. The central weight that we see, the dad bod, that we've just assumed is normal here, that is one of the telltale signs that we're developing insulin resistance. And some people, even if the weight doesn't go down, but the abdominal circumference, the size of their waist starts to shrink, that is telling you that it's working. Mm-hmm. Yeah. That's awesome. The second piece of the puzzle, Melissa, I would say is the exercise piece.
Mm-hmm. Yeah, definitely. Exercise is probably underrated for a lot of things, but in diabetes in particular, it really helps with that insulin resistance. So a lot of times diabetic can take a 15-minute walk after their largest meal of the day and see that decrease in blood sugar. It's almost like giving yourself a dose of insulin, in kind of a roundabout way, because you're increasing insulin sensitivity. And so that insulin that your body is secreting is actually working better. So there's a pretty direct correlation for that. So that's definitely one of those things that anybody who's diabetic or pre-diabetic should not be skipping exercise.
Oh, yeah. Yeah. We have actually, like I said, people who wear those continuous glucose monitors, when they go for a walk, when they exercise, most of them will almost get hypoglycemic. Their sugar will start dropping so fast. And it's such an amazing phenomenon to look at, but it makes perfect sense. Your muscles burn the sugar, right? And so if I strain the muscle, whether it's weightlifting or it's exercising or it's walking, it's HIIT, it's cardio, the demand for the sugar in the muscle skyrockets. Mm-hmm. And when that happens, insulin is not having a hard time pushing sugar in anymore because the muscles are demanding them. In fact, there was a study looking at weight training. So they did a study where they had these people come in and they did squats. And they did heavy squats. And so heavy was actually relevant to the patient. So some people 100 pounds is heavy, some people 20 pounds is heavy. And they were able to almost reverse insulin resistance in these people in 6 weeks. The idea is there are other receptors on muscles called GLUT receptors that don't need insulin to work for it to suck sugar into the muscles, because that's essentially how it becomes efficient, right? If we're really straining the muscles, the body gets efficient at burning it. And again, that is a piece of the puzzle that maybe people don't use enough, right? We'll start cutting the food part, but if you start adding walking or, weight training or going to the gym or even just getting dumbbells at home and doing weight training there, the demand for sugar in the muscles is so big that it will literally start changing your body composition.
Oh, yeah, definitely. It's definitely one of those things that, again, undervalued in a lot of cases, but just adding it in where you can, every little bit counts.
Mm-hmm. Yeah. The last piece, and I guess this is one thing that I was actually talking to a patient. I didn't want to bring it up first, but there is a mental side with diabetes. We talked about, of course, the nutrition part, the exercise part, but we've done even podcasts on mentality, because any health journey, the mind has to be right. There is more depression in people with diabetes than not. And some of it might be just, maybe they feel like it got them. If they fail, I don't know. It's something kind of mysterious, but it is something that we don't want to neglect.
Mm-hmm. Yeah. Well, anytime someone's diagnosed with a chronic illness, it can be difficult to process. For some people, that's, the little jump start they need, kind of wake up call to kind of, get more on track with diet and exercise and just kind of getting back to that, more healthy lifestyle. For some people, it can really be a hard blow and, hard to overcome that, It's like, and especially if they, were fairly, thought that they were doing pretty well to begin with, adding a diagnosis, feeling like they don't have control over something like that can be really, it can be hard to overcome. So that's, an honest conversation to have with your provider, if you're struggling with that.
Yeah. I think some people maybe feel like it's hopeless, like, okay, I got this now. I had a cousin who lost her toe. I had a grandma who lost her eyesight. This is just my future, but we're here telling you it doesn't have to be that way. Right? We can fix this. We can get this better. And we've done that in this clinic. We've had patients that, especially the ones that are really engaged, right? We have patients that just kind of don't care and life goes on and we try our best and, we write medication and we try to control things. But people that really want to take their health in their hands, they're really engaged. They want to try different things. We've been able to reverse some people's, A1Cs of 12s down to 6s or 15s down to 6s, and so I guess that's the encouraging part is we're seeing people that put in the work. They get the results that they want.
Mm-hmm. Yeah, definitely. Everybody has, with the right guidance, the right combination of medication, lifestyle, it's definitely not, that doesn't have to be you that ends up with, amputations or vision loss or any of those complications. There's definitely ways to treat and manage diabetes, and being consistent with that treatment is probably the biggest part.
Mm-hmm. Perfect. Well, Melissa, I guess to wrap everything up, because we can talk about diabetes forever. The first step is we do know diabetes is a big burden on both patients as well as the healthcare system. Step one, you just got to know where you are, right? Mm-hmm. Come in, get your wellnesses, or get your follow-ups. That really tells you and gives you an honest assessment of where your body is and where we can improve. The next piece of the puzzle then is to understand that this thing, medication is important, but this thing is a dietary disease, which means because it's a dietary disease, it needs a dietary fix.
Mm-hmm.
Yeah.
Right. If you're diagnosed with diabetes and, your doctor gives you medication, but you don't have any guidance on nutrition, that's definitely something to look at, to seek out, ask for a referral to a registered dietitian, come see us.
I like it.
But
come see us.
No, but definitely want people to have those resources, and of course, asking for it, because I would rather you ask for it than just go online and consume whatever. Because yes, if you go on the carnivore diet, you're not going to get sugar, but other bad things can happen.
Right.
I think that's where we run into trouble with saying like, oh, just, here's this medication, but you also need to watch your diet. Well, that leaves it up to the patient to kind of consume whatever information online and may get the wrong message. So asking for that guidance where you can.
Yeah, yeah. And again, the goal of these podcasts is to be able to help people get information like that, you know? And so, you know, like I said, we're always here to help. Of course, if this podcast is helpful, feel free to share it, like it, comment, smash, subscribe, all the things, all the things. But, Melissa, I think next week we'll see. If our friend is free, maybe we get her on to actually talk about personal experience with diabetes and how she's been able to overcome. If not, maybe we touch base on cholesterol and statins.
We could, yeah, definitely.
So we'll leave it as a question mark.
Question mark next week. We also talked about headlines too.
Oh, yes. Raw potato juice.
Yes.
Lord have mercy. That would be a fun one too. A top 5 like headlines. So we have options. So
yeah.
Well, Melissa, always appreciate the time.
Yes.
We will do it next week.
All right.